Hi, I'm Hannah Causseaux, and we're going to do a suture demonstration video this afternoon. We're going to start out by preparing the wound for sutures, and what you want to do first is make sure that there is no foreign bodies, no debris inside the wound, so you want to irrigate it very well with normal saline or water. Again, make sure it's cleaned out, there's no debris, and then use this opportunity to confirm the patient's Tdap status. Make sure you don't need to update the tetanus shot at this office visit. And think about wound tension. So a lot of times if you have a horizontal wound, there's going to be greater tension on it as opposed to a vertical wound. So if you need to reduce wound tension, go ahead and be thinking about ways to do that as you suture. And you can do this by increasing the number of sutures and putting them a little bit closer together. That can help you to reduce tension on the wound. So then we want to think about anesthesia. You can use lidocaine with or without epi. So lidocaine 1% and 2% has a 4.5 mg per kg max dose. And if you're going to use lido with epi, then that max dose is 7 milligrams per kilogram. And you want to make sure that you never ever use this on the fingers, the nose, the toes, the hose, and the ears. And then the other alternative is bupivacaine, and you can use 0.25 or 0.5%, and the max dose on this is 3 milligrams per kilogram. And just remember, this does have a longer half-life, so if you have a really large laceration repair or multiple lacerations and you need the anesthesia to last a little longer, you may want to consider this option. If the patient's allergic to lidocaine and bupivacaine, then you can also use sub-Q Benadryl as an alternative. So let's talk about selecting the sutures. So the smaller the number, the larger the thread. So optimally, you would use the smallest thread possible that's going to accomplish proper wound closure. So a lot of times on the face, this is going to be your 5/0 and 6/0. If you have something like a small wound on an extremity, you can sometimes use 4/0 or 5/0. And then if you have a larger wound on your extremities, then that's typically your 3/0 and 4/0 sutures. And then you have, as far as the type of sutures that you can use, absorbable versus non-absorbable. So for the absorbable sutures, you have gut sutures and Vicryl. So gut is used for mucosal repairs or on the face, and its half-life is approximately 7 days. So just kind of think of that. If you need something that's going to last a little longer, then your other absorbable option is Vicryl, and its half-life is much longer. It's 28 days, and this is used a lot of times in subcutaneous layers. So then we're starting to talk about non-absorbable sutures. And the first one is the most common probably, and it's the Nylon. That's what we're going to be playing with tonight and demonstrating. And it's got good memory, and it also allows for some stretch. So as the wound swells, as it's healing, it allows for that good the stretch of the wound. And then the next type that's a little, probably the second most common, I would say, is the Prolene. And it also has good memory, probably greater memory than the Nylon, so sometimes you have to add extra throws on these to make sure that it doesn't come undone. And then on the final non-absorbable option, that's probably the least common, that's going to be your silk or braided suture. And typically these are seen on securing surgical drains, and they are easy to use, but the risk for infection is higher, so they're just not as common. So let's go ahead and talk about the wound and all the tools that you need to have ready. Excuse me. So we're going to be pretending with this wound here. I'm just going to use this edge. So you've got your wound, and then you've got your tools. So obviously you have your needle and thread. Again, I'm using the Nylon 4/0 for demonstration. Excuse me. I've got forceps, and these are great for grasping and helping to control the tissue. You can also use this as a pickup for your needle. I've got this is actually the needle driver, and you can hold it like this. I like to hold it without my fingers in the hole, so I have greater control and can use my wrist on this. And then I've got just a regular pair of scissors that I can cut the tail on the stitch when I'm done. Okay, so I am going to start out, I'm going to use my my forceps and I'll kind of demonstrate what I would be doing. So I'm picking up my needle with my forceps as a pickup. I'm taking my needle driver and I'm going to secure the needle inside the driver. I'm going to go down about 1/3 of the way onto the needle from where it meets the thread. So it looks like, I don't know if you can see that, this. And I'm going to introduce the needle into the wound at a 90-degree angle. And I'm going to swoop my hand up so that I'm going in and coming out at the same angle. Obviously, I would have on gloves. I would have washed my hands and been prepared to do this, but we're going to introduce it at a 90-degree angle into the dermis and epidermis. We're going to come up on the other side. Something else that you want to try to do is align all of your sutures, or your stitches rather, on so that the tails are on one side of the wound so that it doesn't start to heal with it down the middle. So I pulled the thread all the way through. I left myself a little tail right here. I don't know if you can see it. And then I'm going to take my wound and we're going to do what's called a surgeon's knot. So I'm going to hold my thread here and I'm going to do 2 throws going forward. So 1, 2, and then I grab my tail and I make a knot. And then I'm going to go in the opposite direction, 1, and grab my tail and do another knot. I'm going to go 1 in the forward direction again, grab the tail, tie a knot, and then my last one I'm going to go in reverse again, grabbing the tail and making a 4th knot. So that is my first suture. I'm going to make sure it's all on one side of the wound, it's not left in the middle. Then I'm going to take my scissors, I'm going to cut at an angle. I'm going to angle my scissors so that I'm not cutting the tail too short so that the nurse doesn't hate me when she goes to take them out. And then I've got my first stitch. I'm going to go ahead and do, about 4 more of those. I'm going to try to demonstrate 5 simple interrupted sutures. So again, picking up, getting my needle driver, introducing the suture, or the needle rather, into at a 90-degree angle. I want to make sure that they're not too far apart, they're not too close together, so that there's no wound, that it's well approximated, and that there's no gaping in between. Sorry, my computer keeps blacking out here. Okay, so now I'm ready for my second surgeon's knot. I'm going to go 1, 2, and grab. Reverse. Forward. And reverse. Okay. And that's 2. Take my scissors. Cut. Okay. And again, I'm going to use my forceps so I'm not touching it and cutting myself. I'm going to skip just a smidge so that I have enough space in between the stitches so that the thread's not growing on the top. As soon as that needle comes through the other side, I'm readjusting my driver. Oops, and I pulled all the way through. Let's try that again. Through, leaving myself that tail. It's hard to see. Doing my surgeon's knot. So 1, 2, 1, forward, and backwards. One thing I'm trying to make sure is that all the stitches are going on they're aligned on the same side of the wound, and I'm not stitching any tails into the next stitch. All right, so that's 3. Okay, ready for the knot. 1, 2. It's hard to see. Okay. All right, I got one more stitch here. As your thread gets shorter, like mine is, because I've been practicing so much, you have to be careful not to let this needle slip up on you and cut. Okay. All right. So I have been mindful of getting all my stitches all on the same side of the wound, but if I had not been able to do that as I was going along, I could take the forceps at this time and just kind of reposition all of the sutures to one, or the knots to one side of the wound. So at this point, the suture would be done. I did these 5 right here, and I would want to educate the patient on proper wound care. So we would put a topical antibiotic with the dressing on it after the sutures were placed, telling the patient to leave that dressing in place for the first 24 hours. After that, the patient can take the dressing off and gently wash the wound with some warm water and soap, being sure not to scrub. We would want to have the patient keep applying a topical triple antibiotic cream until the sutures come out. Twice a day would be preferable, but it can stay open to the air after that first 24 hours. The key is just to keep it clean and dry. We would want to educate the patient on signs and symptoms of infection to make sure that the patient knew to watch for any excessive swelling, red streaking coming from the wound, drainage, anything smelly or oozing from the actual laceration site, or a fever. That would all be worrisome, and we'd want them to contact the provider. And then just telling them when to come back to have the sutures removed. So typically for the face, that's going to be roughly 3 to 5 days, so those don't stay in quite as long. And then you've got the scalp, which stays in for about 5 to 7 days. For the low tension sutures on extremities, those stay in for about 6 to 10 days. And then the high tension sutures stay in longer on the extremities, and those are for 10 to 14 days. And then if you have sutures on the chest, the back, or the abdomen, then those are usually in for anywhere from 6 to 12 days. So I think that covers everything, and I appreciate your time.